Joining live, and for those that are joining afterwards, welcome. My name is Mark Yorra, and I have a couple of degrees here, and I'll go through a little bit of my history and what I do and give you some background about me. So first of all, I graduated from Northeastern back in 1978. So I have a BS in pharmacy from Northeastern, so I've been a student here. And the big claim to fame for our class is that we had the great Reverend Jesse Jackson as our keynote speaker. And I think it was one of the longest keynote speakers that Northeastern had in history because he likes to talk. The pharmacy program was located in the Mugar Hall building, which is now home to the biology, biochemistry programs. But Mugar Hall was our pharmacy home, and that's where our labs were and classrooms, etc. And I graduated in 1978. It was a 5-year Bachelor of Science program at that time. And I had my first job was on Mission Hill at New England Baptist Hospital. So that was my first job as a pharmacist. While I was working at New England Baptist Hospital, I decided to go for a master's degree. And at Mass College of Pharmacy, which is down the street from us, they had a part-time master's degree in pharmacy, hospital pharmacy administration. So I did that with one or two other people from the Baptist. And I met a lot of pharmacists that were young pharmacists. They were either supervisors or people that wanted to be supervisors or managers. And it was a nice way to meet other people within the city working in the hospitals. I also met a lot of pharmacy directors who taught in the program. So I was starting to develop my network in the Boston area. One of my classmates worked at Harvard Community Health Plan, which is a health maintenance organization that provided services directly to patients. So they had a freestanding center which provided the internal medicine and pediatrics and OBGYN and the dermatology and all the different specialties. And they had a center in Braintree, which is down by Union Street, if people know the area. And at that time, there were a bunch of trailers that were kind of connected together. Now, they've built a huge building ways since then. But I worked part-time just to see if I liked this setting. It was very interesting. I mean, I was working with patients directly, which was nice. It was working with physicians on a one-on-one basis because they all work in the same building. Got to know them, got to have coffee with them and lunch with them. So it was a nice intercollaborative setting, which was good. Then Blue Cross of Blue Shield of Massachusetts opened up an HMO in Braintree, a similar type setting. And they had a full-time position, so I decided that I was at New England Baptist for 5 years. It was a staff position, great job, really enjoyed it, but I didn't feel there was any future movement. So I decided to try the HMO since it was brand new. So I worked there as a staff pharmacist. I did some management training program, but I was there for about 3 years, and it was a nice place to work. I enjoyed working with the medical staff and the nursing staff and the patients. It was growing from brand new startup until it got very busy. I have a lot of colleagues that I work with that I'm still friendly with today. But I was there for about 3 years, and really there wasn't a lot of growth that I was seeing just because the manager brought in a lot of his former colleagues from Harvard Community Health Plan. Job opening at Cambridge Hospital for a supervisor. So I said, oh, let me apply to that. I had my master's degree at that time, and I applied to that, and they told me that the assistant director position was open. They're going to put me into that position since I have the master's degree and I was qualified. So I went right into the assistant director's position. And that was really good because I had a nice director to work under, but he unfortunately left for medical reasons, and I became director of pharmacy after about a year, and then I was there for about 3 years. So It was great because I started rounding with the medical team. They had the blue, the white team, and the ICU team. So we started rounding with the physicians. This was before all the smartphone technology. We introduced fax machines to get orders from the floors to the pharmacy in a fast manner, and that was, leading edge technology, and that cut down a lot of the turnaround time. Because prior to that, we had like this carbon copy that we used to have to go pick up, bring to the pharmacy, fill it, bring it back to the floor. So we implemented some of the new technology to help speed up the workflow. And I was there for about 3 years. It was a great job. It was a city hospital, so it was, an interesting place politically. After I was there for about 3 years, just a lot of political things going on, I was talking to people at the Mass Pharmacy Association about, just other opportunities. And Stop and Shop, which is, Purity Supreme, which is now Stop and Shop, was starting a whole pharmacy division, starting to expand. So I thought it might be good to get into the ground floor of that. So I left Cambridge Hospital, worked for Purity Supreme. They were looking for people to help them with the expansion. I floated between Brockton and Danvers, which is north and south of Boston, and then assigned full-time to the Woburn store. So I stayed there for about 3 years, and all during this time while I was working, I always stayed involved with Northeastern as involved in Pharmacy Alumni Association, and help, support the school in whatever way I could. So I got a call from one of my colleagues at Northeastern that the co-op person that they have currently running the program is going to be retiring, and they were looking for somebody to take over his job. So his name was Bob DeForge, a great guy. I remember he used to have everything in red notebooks in his office, and he used to smoke a pipe in his office, and very different era of being a student in the 70s than it is today. But when they were interviewing me, I basically checked off all the boxes and more. I'm a graduate of the program, so I went through the program as a student. Dr. DeForge is my advisor. I worked in a couple of different settings. I worked at New England Baptist, and I worked at Cambridge, and I worked in managed care. Then I worked in a retail pharmacy, kind of a chain pharmacy setting. So I had a couple of different work settings under my experience, and got to know people in all those different settings. And that is key to this job, because you have to network with people in all different sectors of the profession. It's not just hospitals or chain pharmacies, and that's it. I also was involved in the pharmacy profession quite a bit. So I mentioned the Pharmacy Alumni Association. There's the Mass Pharmacist Association, the Mass Independent Pharmacist Association, which are people that own their own pharmacies. The Mass Hospital Pharmacist Association, which is now the Mass Health Systems Pharmacist Association. So that was the hospital pharmacy group. The Boston Druggist Association, which is more a social group where people from all different practice settings get together quarterly. And I was also involved in the national APHA and ASHP organization. So I always enjoyed networking in pharmacy, getting to know people, being aware of different practice settings. So between my work experience, my network of people, and being a former student and employer. So when I was at New England Baptist in Cambridge, I used to precept students. They felt that I was a perfect fit. So I've been there for 28 years, so obviously it was a good match. So the next step, when I became the co-op faculty, the ASP, which is a student chapter of the American Pharmacists Association, called the Academy of Students of Pharmacy, needed an advisor. So I volunteered to be the ASP advisor, and I did it for about 20 years. And my philosophy, which I've always had, is to get students involved in the profession early so that they can really understand what it's like to be a professional, how important it is to network, how important it is to be visible and active in the organizations. And I did a lot of speakers on campus. So we used to bring in speakers from all different practice settings and from the associations to really expose students to what was going on in the field of pharmacy. And these speakers often were network contacts for students. So if they wanted a job in a specific area, I would connect them with speakers that we've had, and a lot of them got jobs from that. I also did a couple of social things. So we did a day trip to Martha's Vineyard for the students that were in summer classes every year. So that was always a good time, and it was sponsored by usually Osco Pharmacy. And it was a nice day where people could spend the day together, really have some fun, biking, going to the beach, going shopping, etc. And it's a way that people, to bond and get to know each other outside of the classroom. I go to a lot of continuing education programs where I'm kind of like the visible face of Northeastern. Go to conferences and other programs. I'm an immunization trainer. So back when the H1N1 flu epidemic was occurring, back in '97, I volunteered to join the Medical Reserve Corps of Brookline, and I was trained to give immunizations before when it was first made illegal to do that. So I was trained by the Massachusetts Department of Public Health at the time, and I gave flu shots. So the first flu clinic, I think I did 50 patients in 2 hours, and people were like amazed at how fast I worked. And I said, I've been working with needles and syringes my entire career, just not with people. So I pre-filled things, I had them all lined up, ready to go, and had a nice system in place, and it really worked out well. So I've been continuing to do that. And I am currently a member of the Medical Reserve Corps with the COVID-19 vaccination clinics. The state ended up going with the mass immunization clinics and didn't use the local Department of Public Health, but so I wasn't really participating in that, but I still am involved with the Medical Reserve Corps. In 1986, I decided to get a master's degree in health professions and health policy, just because that was the era of Michael Dukakis and the National Health Plan proposals, et cetera. So I did a MHP degree, which is no longer in existence, but I did an MHP degree back in '86. And then I wanted to get a doctorate degree and completed a Doctor of Education degree with a higher ed focus in 2012. So have quite a few degrees, which good to have. And to give you some idea in the co-op program, when I first started, it was basically the big hospitals in Boston, a bunch of independent pharmacies. Chain pharmacies were really just starting to expand. But it was mostly independents in large hospitals. And then when I came in, I had classmates and friends that were in home infusion and long-term care and other settings. So I started to add those settings. And then some of the smaller hospitals that do specialty care, like Mass Eye and Ear and Shriners Burn Hospital. We started adding all these different sites. And then now we have a lot of sites that are involved in managed care, like insurance companies. We have a lot of pharmaceutical companies, or not a lot, but we're working with pharmaceutical companies. There's data analyst and informatics positions, some startup companies, and a lot of opportunities that weren't even in existence when I graduated school. So you just have to learn to change with the times and keep on keeping up with things. So, so we also work with some international co-ops for the early assurance students. So I work in helping students get positions in Malta, Spain, Africa, South Korea, China, India. So for some of the early assurance students that will want to do a international or a home country co-op, we work with that group. As a DE student, it's primarily institutional and community experiences, but we have a lot of options within those categories. So my role, I tell students that I'm a mentor. I try to, mentor students. I try to coach students through the process, through interviewing, through for success in the job and success in the career, in their careers. I'm a cheerleader, so I'm very happy when you are successful and move on to do, residencies or fellowships or get a job or etc. I'm an advisor, so if you have any problems with anything and life happens, so we're very adept at dealing with a lot of issues that occur outside of the program. And we're also a conduit for university services. So if you need help with housing or with food or with, any issue that the university might have an option to help you with, we can connect you with those programs. And I work with another person, Bob Blazer, who's also a pharmacist. He went to the other school, to MCP, and we got our master's together, but he's also been with Northeastern for about 20 years. So what we do is we meet with every student. We usually divide the class in half. He'll take the ADA Ks and I'll take the L through Z last names. We help you prepare a resume. We discuss career options. We work with students to match existing jobs to career plans. So we have a lot of great sites and great opportunities, and we listen to what you want to do. We know what we have in our inventory of jobs, and we steer you to places where we think you'll do very well. So we want to make sure it's a good fit, that you're happy, that the employers are happy, and that you grow as a professional as you go through the co-op experience. We work sometimes geographically. So most of our jobs are in the Metro Boston area, but we've had students work in Long Island, New York. We have the University of Pennsylvania Hospital in Philadelphia. We've worked with Morristown Medical Center in New Jersey. So if students are from a specific geographical area, sometimes it's good to get a job in that area just to get to know the people there and get yourself known. But a lot of times people come to Boston to get the Boston hospital experience, the Boston healthcare experience, and they just want to work here to get that experience, and that's great. I connect students to networks of people so that if you are interested in something that we may not have a job in, like nuclear pharmacy, I can connect you to somebody that does that, a former student alumni, and you can meet with that person and talk about that career path. We coach you through the whole interviewing, job acceptance, performance and evaluation process. And we also help you reflect on the experience. So you may get through a job and say, it was just an okay job, it wasn't my thing, but it does, help you learn what you want and don't want to do in the future. And I also nominate students for awards. So there are several school and university level awards and public health service awards. So I usually identify students that rise to the top, that excel, and nominate them for awards. And I've been pretty successful in getting my nominees recognized. So a little bit about myself. My dad was a mechanical engineering professor at Northeastern from the mid-50s to early 90s, and we overlapped for about a year. He's still doing very well at 90 years old. So Northeastern has basically been part of my life since birth. Married for 40 years, and I actually met my wife at the New Baptist Hospital, my first job. And my first day was a Northeastern theater production. So again, kind of all going back to the same home base. I have 4 adult children, all have gone to Northeastern. They're in marketing, finance, communication, and supply management. And a little update, as of this morning, I have 3 grandchildren. So new one, my little girl was born this morning at 6 a.m. So 3 grandchildren at this point. And I was born at Beth Israel Deaconess Medical Center, the East Campus. I work in Northeastern and live about 5 miles from campus. So I'm really a homegrown person and, you know, love the area. My family's from the area. Northeastern's a great university. Boston's a great city. And I really haven't gone too far from my roots. So with conferences, just a couple of pictures to kind of wrap it up. So we take students to conferences. So we go as a faculty advisor. We don't chaperone. I mean, you know, students are old enough that we don't have to chaperone them. But, you know, we're there should there be a problem. Like one year we had a student that the hotel room got messed up and we had to help fix that. So we're there as kind of an adult on the ground. But, you know, the top picture is the Alamo. We've gone to different places, you know, socially, and we have fun with the students. And then we went to New Orleans for a conference once. That was a lot of fun. And we did a steamship ferry event for the school group. We do, I help out with the Bouvet Health Fair. We do professional meetings where students will present at different meetings. And we have graduates like this woman from Biogen IDEC, you know, was presenting for the company because she works for them. So we really have had a great success with that. So looking forward to working with everybody. We have an introduction to pharmacy practice class Monday mornings, bright and early, 8 o'clock in the morning. And we'll meet you at the first class, and we do about a third of the classes in conjunction with Dr. Reed and Copeland. So we'll work with you quite a bit at that point, and we'll also be meeting with you individually. So that's all I have to say about myself. I'm happy to take any questions or have Christina, you know, take the calls from now.
Great, thank you so much, Dr. Yorra. Really appreciate it. Sorry, I think there's a slight delay on my end there. Oh, and we have an immediate question. I love that. That's great. Okay. Having experienced many different work environments, what would you say is a satisfactory amount of variety and engagement within the field? That is a very good question.
I would say it depends on what you're doing and how much growth there is, really. When I was at the Baptist, again, it was my first job out of college. I learned a lot from, you know, just how to be a pharmacist, how to deal with nurses, how to deal with physicians, how to deal with drug information, etc. But at 5 years, I kind of like peaked out at that job and was not seeing any future growth there, because a lot of the people in management were maybe 10 years older than me and not going anywhere. So, you know, at that point, I felt that it was just time for a change, and I was looking for something different. And that's why I tried the HMOs, and then the hospital position came up, so that was the title. Tried that. Again, it was being a manager is a very challenging job, because you have people above you saying you got to keep the cost of drugs under control and you got to keep your staff numbers down, and then you're sitting there saying, I don't have enough staff to do the work, and these drugs are getting very expensive and we have to have them. Then you're dealing with the cardiologist and the infectious disease docs and all these people. So, you know, you just have to learn how to be a good politician as well as a good pharmacist manager. So, you know, so that was challenging. And then working, you know, for the supermarket, it wasn't a bad job. I enjoyed working there because there was always people in the store and You could always go out and buy something to eat, so I never went hungry. And, you know, but the problem with the retail chains is they're open, you know, 9 to 9, 7 days a week, basically. So I just didn't like the crazy hours that were involved. And then Northeastern was, again, this was not planned, but Northeastern, when it showed itself to me, you know, based on what I did for experience, I covered a lot of different sectors of pharmacy. And some people are very happy working in one job and just kind of growing within the company or the institution. Other people move around quite a bit. And I see that in a lot of, you know, the millennial generation, where they work for a job for 3 or 4 years, they hop to another job, work for a few years. And my 4 children are in their 30s. So, you know, I see that the way they are. And me working at Northeastern for 28 years, you know, you don't see that longevity in employment as much anymore, you know, for the younger generations. So if you're working in a place where you can get a lot of growth and a lot of personal satisfaction, and some people like to be a clinical pharmacist doing ambulatory care, helping people, and they're happy with that, and that's fine. But other people like, all right, I've been doing the same Coumadin clinic for the last 3 years. What else can I do? So, you know, every job has its good and bad points. You know, working in retail had its good points and bad points. In the supermarket, I was like the healthcare person in the building. So if we had a you know, a cashier that was faint, you know, Mark, what do we do? Well, when, you know, when did you eat last? Oh, this morning. I'm like, have a cookie. Other people, you know, somebody got their foot run over in the parking lot. I'm like, call an ambulance. I mean, I'm not, you know, urgent care, but you started playing that role. But you really did help people. That you were the go-to person. So many of the jobs offer many things, and that's a good thing about pharmacy is there's a lot of options. So between the 2 co-ops, your opportunity to shadow people on the co-ops, your 6 APPE rotations, you get a lot of good exposure to different settings. And the tough part is deciding what you kind of like and what you don't like. And a lot of students now are looking at industry or more the corporate side of pharmacy. And again, those are great career paths, but it's not the patient skill, patient interactions that a lot of people look for. So, you know, there's a lot of opportunities, but there's different strokes for different folks, basically. It depends on what you feel most comfortable doing.
Good question and a well-rounded answer. Thank you, Dr. Yorra. Any other questions? We probably have time for one more. I'm trying to keep the recording close to a half hour if we can. Yes, information about the co-ops can be found on the Northeastern website, both on our website and on our YouTube page. So if you go to the Bouvet College of Health Sciences YouTube page, we have a pharmacy playlist, and we have a lot of different videos up on the playlist about students from their own perspective. They each submitted quotes from their experiences on co-op and a photograph. So I think we have about 5 or 6 of those. That's a great place to start to see where in the past some of our students have gone, and then also hear a really short blurb about what they felt they learned on co-op. And then in addition to that, we do have information on the website, and we will be running events throughout the late summer, early fall to highlight co-op even more, different webinars, including a current student panel where they come and answer questions about their own co-op experiences. So those are some great resources to check out, because co-op is definitely a great part of our curriculum. So.
And Nidhi, once you get, and everybody else, once you start courses in September, you'll have access to the software program. It's called NU Works, where every co-op job in the university is posted. We filter it out to pharmacy because we're looking at pharmacy jobs because of accreditation. But that's the software package that you'll be using once you get in. So, you know, just look forward to that. And I'll be going over those positions in the Intro to Pharmacy course in more detail. So at least you understand the difference between a specialty hospital and a teaching hospital and a, you know, managed care setting, et cetera. So you can look forward to that. So you're not going to see a list of every job on the General University site, but we basically have every hospital in the city, every outpatient pharmacy in the city, a lot of the retail pharmacies in the city, and a handful of the drug companies, managed care, and some of the miscellaneous sites.
Great, Nidhi. Thank you so much for your great questions. If you have further questions about co-op or the application process, feel free to reach out to that email that I popped into the chat process. And we look forward to seeing your application soon. Thank you so much, Dr. Yorra. Appreciate it. And hope you have a good rest of the day and get to go see your new grandbaby soon. That's such great news. That's a wonderful thing to have recorded for the rest of time.
Absolutely.
So.
Take care.
Thank you.
Bye.